So this afternoon, we have Channae Haller. Is that correct? Wonderful. I'm doing great already. Okay. We have Channae Haller. She is a certified family peer support specialist, adult behavioral health case manager, and peer support specialist. She has been in recovery for 13 years and has been diagnosed with type 1 bipolar disorder, PTSD, and has a traumatic brain injury as well. She is pursuing a major in criminal justice from the Utah State University. She works on the PrEP team as a peer support specialist for Volunteers of America in Utah. They are a multidisciplinary team helping individuals between the ages of 16 to 26 who are suffering from psychosis or at risk of psychosis. Additionally, she has founded a nonprofit organization called Justice by Objectives that provides peer support and family peer support services to those within the criminal justice system. Please give her a warm welcome.
Hello. So I'm Channae Haller, and I'm going to be doing a presentation on cannabis and psychosis, so the facts, myths, and mental health. And I just wanted to start out. So I'm just going to do a check-in and just kind of touch base and see how you guys feel about some of these sentences. Cannabis provides more benefit than risk. Cannabis is safe. Cannabis should be legal for recreational purposes. Cannabis should be legal only with a medical prescription. And then I feel comfortable using cannabis or trying it. Strongly agree to strongly disagree. And so I was going to start off with a joke. Someone told me one that actually was pretty good, so I just wanted to start off with that. So a man keeps hearing these voices. He keeps hearing these voices telling him to go and take out all of his money and go to Vegas and leave his wife. Just kind of hearing it over and over. And he didn't understand why. So finally, he actually listened to the voices and he decided to go to Vegas. So he went to Vegas. And now the voices were telling him other things to do. So the voice told him to go to Caesar's Palace. So he went and booked a room at Caesar's Palace. And then the voices were telling him to go gamble. So of course he was like, okay, all right. So he decided to take out his money. The voices were telling him to take out all of his money, all the money that he has. And so he took out all the money that he had, and he went to the roulette table. And the voice told him to put it all on black. And so he's like, okay, I think I'm going to listen to this, so I'm going to put it all on black. Then all of a sudden, roll the dice, it lands on red. The voice then says, fuck. Just little fun humor especially with the topic like psychosis. Sometimes we, don't want to always listen to the voices that we hear that are inside of our head. And so I'm just going to do a brief introduction to myself. My name is Channae, and I am a certified family peer support specialist and also a peer support specialist. I also have just got certification for adult behavioral health and case management, and I am in long-term recovery. I have been in recovery for 13 years, and I super happy and thrilled about that. And that's what kind of led me down the path of peer support, as well as being diagnosed later with bipolar disorder. I also have PTSD and anxiety disorder, and it has given way for the peer support. And just a little backstory. I mean, I also had a family member that was struggling with addictions. My father was an addict, and from an early age, I kind of already knew what addiction was. He was in the band, so it was very in the scene of his punk rock band that he was part of. And that's what kind of led down that path. But I ended up turning to substances after a traumatic brain injury and car accident that led me to be prescribed fentanyl. So I was prescribed fentanyl back when I was 18, and became severely dependent on it, as well as just I couldn't remember anything that was going on, like short term. Long term, I still have my long term memory, but short term memory was really hard. I couldn't retain any of the information when I was in college. I couldn't retain any of the information that someone would tell me, just kind of a person. So that was really frustrating. So the substances definitely helped with all of the things that I was struggling with. And so I turned those substances. I went to multiple treatment centers, and finally it stopped. And I went to a treatment center that helped me save my life. They gave me the tools that now have led me to being in recovery for 8 years. They're amazing. I ended up working for them. I ended up being the registration specialist over in their Colorado facility. I'm actually originally from California, moved to Colorado, and then ended up moving to Utah and starting a family. And that's when I actually was diagnosed with bipolar disorder. I was going through a very just abusive relationship. I left that relationship. There was a lot of traumas that were going on, and it triggered a lot of the psychosis. So I started hearing, seeing things that weren't quite there, and it debilitated me in a lot of ways. But it led me down the path of wanting to become the peer support that I am now, and helping people that have experienced certain things that I have experienced. And I've learned a lot with having bipolar disorder. I haven't had psychosis or any sort of psychotic symptoms in years, so it's been a while. And let's get into the presentation. Okay, so we are, I'm from Volunteers of America of Utah, and I'm on their PrEP team. So their PrEP team is prevention and recovery from early psychosis. So we are helping the age range from 16 to 26, and we're helping those that are clinically high risk of psychosis or are in first episode of psychosis. And we are a mobile team, so we'll drive around, we'll go to clients' houses, we'll take them to appointments. We specialize in getting them to and from wherever they need to. We're team-based, and so what we do is we meet with our team, twice a week, and we evaluate and talk about each client that is on our team, and we're always working with our client and our client's family to make sure that the proper plan is in place and that we're working together. And then, so we have multiple people on our team. So program manager and a therapist. We have a psychiatrist. We have a case manager and vocational specialist. peer support specialist, and then the occupational therapist. So we just hired on an occupational therapist, and we're so excited about it. And we actually have a case manager here as well, and it's been awesome. The prep team, we really just try to cater to the best needs of our clients and what we can do to help them with first episode psychosis and the early stages of psychosis. And so we are funded by Mental Health Block Funded Grant. We are also, we accept all people. We do not, if you didn't have insurance, you're more than welcome to be a part of our program. We also, doesn't matter about your immigration status as well, you are welcome to be on our team.
Is this all county, Salt Lake County?
This is Salt Lake County.
Okay.
Yes, Salt Lake County. But there are multiple.
I know there's something in Davis County and even Utah County.
Yes, Davis, Weber, and then Wasatch.
Okay.
Yes. I think that's on the next. Yeah, right here. So there's other prep teams. And we provide services for 2 years to the clients that we have on our program. But yeah, if they are not in Salt Lake County, that's the nice thing is that there are other places as well that they can go to. So we are recovery oriented and evidence based. We use everything from research, making sure that we are giving them the best quality and the best information possible. We have, from our statistics and from the research that we have, we've reduced hospitalizations, improved employment. All these people that we have as clients are getting back into the workforce. And then it's just improved their quality of life. They are doing so much better just with everyday tasks. They're able to, wake up and function, get their clothes on, the things that are simple tasks they're able to get back to doing. And again, we're recovery oriented, and the biggest thing or the message that we want to spread is that the message of hope. So with hope, that always forms recovery. If we didn't have hope, we wouldn't have recovery. But there's many pathways to recovery. There's holistic approaches, there's peer support, there are different approaches to recovery, but we definitely want to instill the message of hope. So we collaborate all together as a team, just making the decisions all together, making sure that the family is involved, making sure that the client is involved, making sure the team, no one's doing anything, without someone else's knowledge. Everyone works together and we just collaborate, and it's been an amazing experience. And so our goals. Biggest one is, we want to raise awareness about psychosis as well as schizophrenia, and just making sure that there's, that people are understanding and that decreasing that stigma. There's a lot of people that are, when they think of schizophrenia, they think of psychosis, they think of someone that's going to be aggressive or harmful. That's not always the case. So just making sure that we're educated and knowing how to properly handle a situation when someone is in psychosis. And our biggest thing is to preventing the onset and reducing the impact of psychosis on the youth. That's where we're seeing it, especially within males, is earlier in the youth and teens. And we just want to help with helping with that duration of untreated psychosis. We want to do that early intervention program because statistics have proven that it is best to intervene earlier, and so that it doesn't go into full-blown, we can actually catch it really early and before it gets into a later stage. and make it far worse for that individual. And what is psychosis? So some people, have heard it, and psychosis is really someone that is having an altered state of reality. It's they're not perceiving what is real. And the duration of untreated psychosis. The longer that it is untreated, far worse that it can get, and someone can just be debilitated from the psychosis. So duration of untreated psychosis, roughly around 1 to 3 years. And the WHO is recommending that you get treatment within the first 3 months of being diagnosed. And they have a really hard time with people that are substance induced psychosis, just because of having that dual diagnosis sometimes excludes them from certain programs. So they do have a tougher time in order for them to get into certain programs. Also, there's a fear of stigma around their cannabis use because a lot of, especially if they've been diagnosed and been told not to use cannabis, it makes it harder for them to communicate to other people that they are using it with fear of the stigma. So then they go untreated for a little bit longer as well, just because of that. Our biggest aim is to reduce hospitalization, reduce time in treatment, reduce, we just want to have long-term impact on these individuals and making sure that they have a very successful life and that they can get back into the swing of just being, quote unquote normal. So this slide is pretty cool. It's showing, so if you were to help early treatment, it stays pretty consistent and you're not going into the active stages. So that's pretty cool just to see that early treatment is very crucial. But if it's pre-morbid and then it starts to go down, obviously you're seeing in the active stages and it's already getting to a certain point that it could cause severe damage. So that first appropriate treatment they're seeing it is when it's at the active stage, but the best would be seeing it at that early prevention. And what are the differences between psychosis and schizophrenia? So psychosis is a group of symptoms. And it has a group of symptoms that have hallucinations, delusions. They're a symptom. Psychosis is a symptom of schizophrenia and other psychiatric disorders. But schizophrenia is a chronic, it's a lifelong illness. It's characterized by the presence of severe psychotic symptoms. And so, once again, to differentiate, a group of symptoms is psychosis, and then schizophrenia is a lifelong. And this is just showing in the DSM-5 what schizophrenia actually is. Diagnosis. Hallucinations, delusions, disorganized speech, continuous disturbance. So with schizophrenia, it's 6 months and longer. And I'll go into that with the next slide. So with brief psychotic disorder is 1 month and less. So having those symptoms that are 1 month and less. Schizophreniform disorder is 1 to 6 months. And then there's schizophrenia, which is the 6 months and over. So it just is different for each based on the time periods. Okay, and so there's a lot of overlapping with certain disorders, just with their symptoms. There is bipolar disorder, there's psychoaffective disorder, and then there's the schizophrenia, and a lot have shared genetic determinants. So, and then also symptoms.
Have they found anything genetic though? In 30 years, I've heard they haven't
So they
isolated a thing.
So they have found, I mean, in family history. So family history.
Environment and history.
Exactly. Well, family history with the genetics.
But no genes have been found.
No, but based on like immediate, you know, your immediate family members, based on that, like if you've had obviously a father who was schizophrenic.
History and environment.
Correct. Yeah, history and environment. I wish that there was more, I mean, in depth on that we could just pinpoint exactly. Because there's a lot of different risk factors and different things that could contribute to it. But those are the biggest things. Yeah, I mean, we see a lot with the family history. You're more than likely, but
Unfortunately, nothing isolated.
yeah, yes, unfortunately.
Or fortunately, I
Yeah.
don't know.
Yeah, right.
I mean,
Yeah. And but like how it says right here, so clinically high risk for psychosis is usually more inclined to have, you know, someone that is a relative, or first degree relatives, schizophrenia, bipolar, psychoaffective disorder. Most have a genetic disposition, but it doesn't mean that they're always going to get it. So don't be scared if all of a sudden that you find out that your uncle had schizophrenia. It doesn't mean that you're always going to be the one that's, you know, end up getting it. Just be cautious. And statistics used in the fields of breeding and genetics. Sorry, I read the wrong thing. Sorry. Okay. So these are the multicultural and psychosis risks. So there's some like even when mother was pregnant and she was cleaning the cat box, actually contribute to some of the risks. Late winter or spring birth, which is interesting. I mean, it's a very small percent, but still it's something that they contribute. And then increased paternal age, from age higher than 34, traumas, social adversities. We see the strongest association observed among the Black community, Black individuals. Black, Latino, and Asian individuals in the USA reported growing up in neighborhoods with higher proportions of outgroup ethnic minority individuals reported more psychotic-like symptoms than those who grew up in ethnically concordant or predominantly white neighborhoods. But we do see statistically it's more in Black individuals. This is just kind of some statistics that I found kind of interesting. 3 out of 100 experience psychosis. Some could be lifelong, but some could just be a brief moment or a brief moment. Schizophrenia is one of the top 10 leading causes of disability globally. Suicide is also 12 times more common in first episode psychosis than in the general population. 24 times mortality rate 12 months after the initial psychosis diagnosis. And then also 60% increased risk of suicide in the first year of treatment compared with those in subsequent phases. So those are all pretty interesting, especially I don't think it was as common with psychosis with its in 3 out of 100. So cannabis-induced psychosis. Cannabis has the highest rate of conversion from substance-induced psychosis to schizophrenia or bipolar. Out of all substances, that's meth, out of any sort of other substance, but cannabis is the highest. 1 out of 200 experience cannabis-induced psychosis, especially with the higher potency of the cannabis now. A lot more people are becoming or having cannabis-induced psychosis.
I just have to comment on that. I think it's interesting because there's this question about the genetics.
Yes.
And there are some genetics that will identify people who should not use cannabis.
Yes.
And I would be curious to see if those also correlate with this.
So they do, with
They do.
schizophrenia, and yes, so that's what kind of leads into the topic. Cannabis and psychosis do not go hand in hand. It actually, heightens and also makes them go into a psychotic state. And also even with their antipsychotics, it'll actually, it will work. The times when they're using the cannabis, it stops. But I'll go on more, but that is very interesting with the genetics. And then this is just in the DSM-5. There's different, just about cannabis use disorder, cannabis intoxication that's inside of there, cannabis withdrawal, cannabis use disorder, and cannabis-induced psychosis. Some of the evidence that has come about, this is like the dose and frequency. So right now, since there is such a higher dose inside of, this potent cannabis products compared to back in the 80s or anything like that, it definitely makes you go into more of a psychotic state and psychotic risk or psychosis risk. And then also frequent use. So if you're using it regularly every single day, using that high potency, and you have that predisposition of having, dad who's schizophrenic, or having an uncle who's bipolar, or any of those things, you're more than likely to be more susceptible to go, especially cannabis use psychosis. And then it's starting earlier at the ages as well. It's just with people trying out, when they're younger, trying out cannabis for the first time, and then they're trying like the 30% THC potency. Sometimes can lead them down into psychosis much earlier than if they were trying it when they were back in the 80s. So 60 to 80% of young adults with first episode psychosis reported using cannabis. A lot of the clients that I see and a lot of the clients that we have do partake in cannabis, and it is a hard one to get them to stop using, even when you are suggesting and telling them that it's going to lead them to psychosis. But cannabis use can include someone going into relapse and psychotic symptoms. Those can increase, as well as medication adherence. That's a huge one. So they stop using their medications because they start becoming reliant on the cannabis and thinking that the cannabis is going to be their cure-all, solve-all, and it's going to be working effectively for them, and all reality actually makes it worse. Cannabis is actually one of the most preventable causes of psychosis relapse. So if we would be able to help, kind of get that message out to a lot of the individuals that have been diagnosed and that are using it, hopefully they can understand and better use that information so that they don't go back into it. And about 1/3 of young adults with first episode psychosis meet the criteria for lifetime cannabis use disorder, higher than what is found among young adults in the general population. And then continuing cannabis, I keep reiterating it, but continuing cannabis use while first episode psychosis or after being diagnosed with first episode psychosis is really, detrimental to your mental health and progressing into something more positive. And this is just showing pretty interesting but just to cannabis users at age 15. And this is, they're at a higher risk of schizophrenia at a younger age of their first use of marijuana. So 4.5% at 15 years. And then the more you're using, the more likely, especially if you have those predisposed contributors, that you're going to be diagnosed with schizophrenia. And this is marijuana use. It's just kind of showing the age ranges where people are using it the most. I think it's, it's around 18 to 25. And that's where we're seeing, first episode of psychosis is usually around those ages. And so we, I think majority know the risks of certain substances and how harmful it can be to someone, but it's showing heroin use the top, cocaine use once or twice a week at the top, marijuana. I'm not saying marijuana is a horrible substance. It's just not the best for someone that is has psychotic features or psychosis or schizophrenia. So it's not harmful in certain ways, but it is harmful to some. And the most widely used drug is marijuana, cannabis. It's pretty common now, especially with it being more legal and accessible. And so this was pretty interesting, is it shrinks the brain. So schizophrenia and the hippocampus, it shrinks the part of the brain that is responsible for your memory and learning. This small structure helps you remember both short and long term and gain awareness from your environment. The hippocampus is at risk of injury or damage from underlying conditions like Alzheimer's disease or schizophrenia or anything like that. It shows shrinking of the brain techniques. And so gender, psychosis, and cannabis. So they do see a lot more male, more likely to be diagnosed with psychosis, schizophrenia, is more male. And that is onset, like how I was saying before, is more teens. So that's why we can help that group with the PrEP team is the age range 16 to 26, because that's typically where we're going to see early stages of psychosis. And then women is later 20s to early 30s. When I experienced mine, it was late 20s. And when I start reflecting back on all the experiences I did, it was definitely the early 20s that I noticed a lot more of my symptoms. And cannabis use is more prevalent within the male. Not sure why, but it's more frequent. And also significantly greater among transgender men compared to transgender women. Everyone knows those guys. But back in the day, it was at 2 to 5% THC, and by 2014 it was 12%, and now it can go up to 30%. Products have up to 30%, which is very, very high compared to back in the 80s. And so, especially if someone is more predisposed to being affected by psychosis, you're definitely going to see that at an earlier age and earlier onset. And this is just a dosing kind of chart. It's just showing, the different milligrams. Obviously, you're going to be starting to see like paranoia, nausea, all of that in the 100 milligrams. 5 milligrams is usually average. A lot of the times when you're younger, you aren't really asking that type of question, what the milligrams are or what you're taking. You just want to try something and you're hanging out with friends. So you really could be trying something that's 100 milligrams. And it's really scary, especially if someone is more inclined to become, have psychosis. So.
I'm curious on that. Is the psychosis features likely to show up during the use or as a result of like the rebound?
So when they are using a substance, some go straight into psychotic features right after using it. You've seen it like that, or prolonged using it every day, and then all of a sudden having that psychosis. Frequent use is when you're going to see it more often as well. But we've been seeing it first time, first time using it, just because the potency.
My mom has but she's also bipolar, so she tried the marijuana for the first time.
Yeah.
Sent her instantly 2 minutes, never again touched.
Yeah.
So fascinating.
Because you wouldn't know. Yeah, you would have no idea. And so, you might be predisposed, just based on, like your uncle, aunt, or, brother, sister, anything like, or someone immediate in your family having had it. But you don't know. You don't know for sure. She's CBD now. But okay. That's hard though. Yeah, it's very good. And so this study is just, it's just stating that CBD really, so virtually like the high potency products contain CBD in them, but CBD doesn't really change or alter the psychotic or the psychotropic effects that THC does. CBD doesn't really cause as many of the effects on those. So even just adding that to the higher concentrates, it's not going to affect it. And so dopamine. So what they're contributing, with antipsychotics, they are helping to lower your dopamine. And so complex interaction between marijuana and dopamine is a huge factor, as well as when you have psychosis as well, dopamine changes and alters. But dysregulation of dopamine is in the pathophysiology of schizophrenia. So implications for treatment. So continued cannabis use is going to be associated with, antipsychotic non-adherence. A lot of the times when we see clients, when they start to, they stop using and then they go back to using cannabis, you can start to see them, not using their medications as much, and then starting to slip up and not wanting to go to work or not going to certain activities. They start to isolate. They will end up going back into the hospital as well because it ends up sending them into psychosis. And so findings suggest that targeting cannabis use during the high-risk period may confer significant benefits on long-term outcomes. So just, kind of nipping it in the butt from the very beginning and just making sure to educate properly, letting your clients know or letting the clients know that cannabis, especially if you're have psychosis or schizophrenia or psychoaffective or any of these disorders is not going to be beneficial for them and actually will lead a really hard life for them. And so we use a harm reduction approach. We would like all of our clients to not use any of the substances, meth, cannabis, anything when they're in our program. We love for them to be successful. But the best approach is just promoting the safer behaviors and just educating. The big thing is educating. And so treatment for young people experiencing psychosis. So what I have come to see, as well as what I have learned from my own self, is just having you have a great toolbox of different things that are going to help you. Every person is different. We individualize for each person. So like for my own toolbox is completely different than someone else's that has experienced psychosis or has bipolar or schizophrenia. And we just want to make sure that the follow through is going well, because a lot of the times with us working with younger population, sometimes it's harder for us to get through to them to go to certain appointments or certain things like that. Research indicates that treatment for co-occurring disorders should be provided in an integrated and seamless way. So we work with other organizations as well and work hand in hand so that if there's anything that one of our clients needs that we can't help with, we help with another organization. The biggest treatment is early intervention. That is the biggest way of helping with this early stage of psychosis within this younger population, is helping to make that right in the very beginning. And I always advocate and strongly suggest, medications help me tremendously. And so I definitely.
We're hearing it too.
I know. It's not just me, right? Okay. Okay. But the biggest thing, and I always try to communicate that to clients, is medication is key. Medication has helped save my life. Medication is what I don't experience the symptoms. I don't experience any of that psychosis anymore. I'm not believing I'm communicating with people that aren't there. So it's a very it's definitely what I try to educate our clients on is medications, talking to the psychiatrist, making sure that they get the proper knowledge and the proper education on all of those things. And then cannabis and psychosis, just from what we've discussed this whole time, cannabis and psychosis do not go hand in hand. So if you were to take something out of this, and if you've never heard about this and never heard about psychosis with cannabis, just a takeaway would be, if you have clients, if you're working in secure sport and you have clients that are, going through psychosis, going through schizophrenia, going through any of these things, just making sure to check in on them if they're using cannabis, because you could see, them to kind of start to fall back if they start using it again. And so this is the fun word of the day. I still cannot say it, so let's see if I can do it. Psychotomimetic, right? So that's why I was doing this, is just to kind of, see who, see how you guys take this word. Have you guys, show of hands, have seen this word? No? Okay, no, I redid it, like, it's because I see the word and I see psycho. So, but it's not, it's like psychotomimetic. Psychotomimetic. Anyways, it is an adjective that describes a substance or drug. So LSD, anything that causes hallucination, that is what this word is. And so I thought it was kind of fun just to try it, like, if you just say it out loud or try to say it out loud, it's kind of fun. So, you're right. But I had to rehearse it like so many times, just trying to get it down, and I still can't get it down. So, but they're also known as the, so just LSDs, the psychedelics. Okay, and so signs of clinical high risk of psychosis. So they're going to have delusions, they're going to have hallucinations, they're going to have incoherent speech. Sometimes, even writing is really kind of all over the place. Functioning is a little bit inhibited. Behavior that is inappropriate for that situation, or saying things that are a little inappropriate. And then trouble thinking clearly. You'll also see like a reduced performance. This is with a lot of mental health conditions and disorders. You'll see a reduced performance. So I'm not saying that it's only that they have schizophrenia or psychosis or stages of psychosis if they have a reduced performance, but that's what you will see. You will see a huge reduced so like trouble reading and writing. We've had clients that have been rock stars, and then all of a sudden they're in college and they're doing really successful and they have full load, but then all of a sudden they have psychosis, and now they can't even take a class. So it's pretty debilitating, and you just start to see that performance start to reduce. And the behavioral changes. So fear of for no apparent reason, like thinking people are out to get them. Bizarre beliefs. A lot of it depends on where you are or what culture or culturally where you're from. Sometimes those can be a part of those beliefs as well. So maybe if you grew up very religious, sometimes some of your beliefs can be far-fetched and grandiose from religious experiences. Sometimes extreme social withdrawal and decline in appearance. But I've also seen it the opposite. Someone that's like dressing a complete different way than what they're used to, like maybe very provocative, and they weren't ever that way before. And this is a huge one, is dramatic changes in sleeping and not sleeping can cause a lot of disturbance in psychosis. And then perceptual changes, just fear of others trying to hurt them, sensitivity to sights and sounds and smells. I know, like mine, I kind of like the sun. I was always like my eyes. My eyes water a lot. You'll hear certain things like my brain is playing tricks on me. Visual changes, colors more intense, face distorted. I can see a lot of like iridescent and like rainbow during my time of psychosis. Putting thoughts, so telepathically, like they're thinking that someone's putting thoughts in my head. I thought I was communicating with someone in these free little libraries, like communicating with them telepathically, and that they were going to do certain things. So those were kind of my signs and changes. All right. So just the amount of information that has been given and what we've seen with our own clients is just cannabis and psychosis, do not go hand in hand. And just reiterating it, and even when I asked our psychiatrist, the doctor, on our team, like, I just any pointers for what I should say inside of this, and she just said, you know, if you have psychosis or you have schizophrenia, just don't do it. Just don't do cannabis. That was her advice. And so the biggest thing to be that takeaway is just don't do it. You know, because if you see that it's going to cause you more harm than good, just try your best and communicate to your doctor you're having any of those feelings or urges to use cannabis. You have been diagnosed. Especially when initiated early in life, it's better to, you know, just be on top of it. You know, if you have someone in your family line, it's always good to, like, just, you know, make sure and be aware that you could potentially be at risk of having psychosis or schizophrenia, and especially if you were to maybe never try cannabis and all of a sudden later in life try it, you very well could go into psychosis. And frequent cannabis use. Consumption of the high potency cannabis is just a higher risk of developing psychosis when using those higher potencies as well as just using it, you know, daily. Several genotypes moderate the impact of cannabis use on the psychosis risk, particularly those involved in the dopamine function. And just changing your behavior, those are the biggest things. I mean, I was a cannabis user every day, multiple times a day, and you know, you just got to change the way of what your, you know, everyday life is going to look like after finding out that you have psychosis or have these, you know, disorders. You just want to make sure to listen to what your doctor is saying, and I had to change a lot of things. I mean, I thought for a long time that cannabis was kind of the cure-all, and in all reality, it's not. So I've learned a lot while working with this team, as well as, you know, just with my diagnosis and learning a lot more about it. That cannabis is really harmful and detrimental, actually, to someone that has psychosis or psychotic features. And so I'm going to do like a little check out, and it's the same ones that, you know, just kind of that were said in the very beginning. And so just agree or disagree that cannabis provides more benefit than risk. Agree or disagree that cannabis is safe. Agree or disagree that cannabis should be legal. And I feel comfortable using cannabis or trying it. So I just wanted to leave it off on that. But yeah, if you were to take something away from this, is just cannabis and psychosis do not go hand in hand. And if you're working with clients that have schizophrenia, have psychosis, have these disorders, they shouldn't be using cannabis. As much as like it's become legal and medical cards and you can do all these things, that's really nice. And I hear it, you know, I've heard it from clients. And I just get my medical card. Well, it's not the fact of it being illegal or legal, it's the fact that it's very detrimental to your well-being. And, you know, the life expectancy of, you know, people that are living with schizophrenia or psychosis is a lot less than someone that doesn't have any of those. And so it's just, why not, you know, take care of yourself a little bit better so that you know, don't have to take your Yes.
I really like how you're framing this because we could also tie it into opiates.
Correct.
There is legitimate pain management use for them, but the addict is likely to find a way to abuse that. And if
Oh,
we-
for sure.
And if we frame this in the same way,
Mhm.
it makes sense.
It makes more sense, yeah, and, you know, because a lot of people think that you can't become addicted to cannabis as well. Well, there is cannabis use disorder, and, you know, after long periods of time, but yes, you know, you can use it effectively for your clients, your patients, you know, and just educating them on the effects of cannabis.
So information getting shared with the doctors that give medical cards for cannabis use
Is it being shared?
with them, you know,
Oh,
so
I
they
don't-
do a good screening of who
I mean,
they
we
might.
should, right?
Yeah,
I mean,
exactly.
definitely, maybe we should go and approach them with more of the information.
More
Because I don't know,
information.
yeah, like more of the education, because they're probably, I mean, you might have some questions.
I think the most it does on if you go to the dispensary and on like the
It will, huh?
it now says they affect your mental health and that's part of it.
I mean,
But
anyone
if
with
you get
the,
a card, I mean,
Yeah.
they don't do much of the screening.
so anyone with the DSM-5 will see it in there, but when our doctor, so I'm on the prep team doctor is frustrated that you can't rescind a card. once it's given.
Right.
You can like not renew it, but they can just go find another doctor, take their case. And it's a new thing, right? Like if you get some off the street, that's completely unregulated. You have no idea what's in there. But even in the stores, this is new. Like you don't know. You can get stuff thinking it has no THC, just CBD, but maybe it actually has a little, or it could be a higher concentration because it's just a very new kind of industry. So,
Definitely need to address that, like, 'cause that's something that, should be yeah, no, just because, I mean, I've learned so much, like I said before, I used to think that cannabis was like a cure-all, you know, like, oh, in all certain ways, just, you know, and it's very minor, so, I've learned a lot that way, and just, yeah. More education is what it's. But any other questions or anything? Awesome. Well, I just thank you guys so much.